Welcome to today's video where we'll be discussing a fascinating and sometimes complex condition known as renal ectopia. Renal ectopia, also referred to as ectopic kidney, describes a situation where a kidney is located outside of its normal position within the retroperitoneal space. Join us as we delve into the causes, symptoms, diagnosis, and management of this developmental anomaly. So, what causes a kidney to end up in the wrong place? Renal ectopia is typically a congenital condition, meaning it's present at birth. It arises during embryonic development, specifically during the ascent of the kidneys from the pelvis to their normal position in the abdomen. This ascent can be disrupted by a variety of factors, including genetic mutations, exposure to certain teratogens during pregnancy, or other unknown developmental disturbances. In essence, the kidney gets stuck somewhere along its normal migratory path. While pinpointing the exact cause in each individual case can be challenging, it's important to understand the developmental origins of this condition. To understand the effects of renal ectopia, we need to consider the pathophysiology. The key feature is the abnormal location of the kidney. This misplaced kidney often has an abnormal blood supply, ureter length, and drainage pattern. Because of the abnormal location, the ureter might be shorter than normal, kinked, or obstructed, leading to hydronephrosis, swelling of the kidney due to urine buildup. Functionally, the ectopic kidney may function normally, partially, or in severe cases be non-functioning. The degree of functional impairment depends on factors such as blood supply, the presence of obstruction, and the overall health of the kidney tissue itself. It is also prone to other potential secondary conditions because of the abnormal location. Determining the precise epidemiology of renal ectopia is difficult as many cases are asymptomatic and go undetected. However, it's estimated to occur in approximately 1 in every 500 to 1,000 births. Pelvic ectopia, where the kidney remains in the pelvis, is the most common type. Renal ectopia affects males and females equally. While most cases are sporadic, meaning they occur randomly, there may be a slight increased risk in families with a history of congenital urological anomalies. The signs and symptoms of renal ectopia can vary widely. Many individuals with an ectopic kidney are completely asymptomatic, and the condition is discovered incidentally during imaging for an unrelated issue. However, when symptoms do occur, they can include abdominal or flank pain, urinary tract infections, kidney stones, hematuria of blood in the urine, or symptoms related to hydronephrosis. In some cases, renal ectopia is associated with other congenital abnormalities, such as abnormalities of the reproductive system. The presence and severity of symptoms depend on the degree of functional impairment, the presence of obstruction, and any associated anomalies. Diagnosing renal ectopia typically involves imaging studies. An ultrasound may be the first test performed, particularly in children. This can help visualize the kidneys and detect any abnormalities in size, shape, or location. A CT scan or MRI provides more detailed anatomical information and can help confirm the diagnosis, assess the blood supply, and identify any associated complications such as hydronephrosis or kidney stones. A VCUG, or voiding cystoscopy, can be useful to look for vesicurtile reflux, where urine flows backwards into the kidneys from the bladder. In some instances, a renal scan may be used to assess kidney function. While there aren't distinct formal classifications of renal ectopia beyond location, we can categorize cases based on specific characteristics. Firstly, based on location, we have pelvic ectopia, iliac ectopia, abdominal ectopia, and thoracic ectopia, with pelvic being the most common. Secondly, we differentiate between unilateral ectopia, where only one kidney is misplaced, and bilateral ectopia, where both kidneys are affected. Crossed renal ectopia, a unique type, occurs when both kidneys are located on the same side of the body, and one kidney has crossed over the midline. Thirdly, the presence or absence of complications such as hydronephrosis or associated congenital anomalies also helps describe the condition more comprehensively. The management of renal ectopia depends on the presence and severity of symptoms. Asymptomatic individuals may require no treatment at all, but regular monitoring is often recommended to detect any potential complications. For those with symptoms, treatment options may include antibiotics for urinary tract infections, pain management for abdominal or flank pain, and interventions to address hydronephrosis or kidney stones. In some cases, surgery may be necessary to correct anatomical abnormalities, relieve obstruction, or even remove a non-functioning kidney. The approach is individualized based on the specific findings in each patient. As renal ectopia is a congenital condition stemming from developmental issues, there are generally no specific preventative measures one can take to avoid it. However, women planning a pregnancy should ensure they are in optimal health, avoiding teratogens such as alcohol and certain medications. Genetic counseling may be recommended for families with a history of congenital urological anomalies to discuss the potential risks of recurrence. The prognosis for individuals with renal ectopia is generally good, especially when the condition is diagnosed early and managed appropriately. Many people with renal ectopia live normal, healthy lives with minimal or no complications. However, regular monitoring and prompt treatment of any associated problems, such as urinary tract infections or hydronephrosis, are essential for ensuring long-term renal health. Recent research focuses on understanding the genetic and developmental mechanisms underlying renal ectopia, with the hope of identifying potential targets for future interventions. Advances in minimally invasive surgical techniques are also improving the treatment options for individuals with symptomatic renal ectopia.